Alright, this is going to be a video to go over a cupping technique, specifically for medial epicondylitis or golfer's elbow. So I'll go through some of the things that you need. I like to put a little bit of lotion. Any lotion is fine just to increase the suction or stick of the cup against the arm. So the cups that I'm going to use are going to be vacuum. So these cups are going to attach to a pump that's going to suck the air out and pull the skin away from the arm. I'm going to talk about how you could do this to yourself first, and then at the end I will talk about how I personally will move the cups around, right? So I'm going to take a little bit of lotion and I'm going to put it on her forearm. If I'm focused on medial epicondylitis or this golfer's elbow, that's where I'm going to focus most of this lotion at, right? Now, typically she would be sitting, maybe arms supported, or if it's someone doing this on themselves, they'd be sitting with her arm on an armrest or on a table. Now, the cups come in all different sizes, so I just want to make sure I have one that's, not going to completely be huge and cover her whole forearm. And I want to stay off of the tendon to start. So if we say that the tendon maybe starts here, up by the inside of the elbow, I'm going to come down more into the muscle belly. So like this, top third of the arm is where I'm probably going to start with the first cup. And then I'm going to come to the other end, probably down towards here where those muscles are already starting to turn into a tendon. So for the forearm, there's not going to be a lot of distance between the two. Now, the only concern when you put these cups on is that if you draw too much air out, you could definitely leave a nice bruise. I don't really need to do that, right? So as I put this on her forearm, and I come down just a little bit away from the tendon, I have this to pull some air out of the cup. So I'm going to stick this to her forearm and just lightly pull a little bit of skin away. All right? So it's not really all that complicated. Now if you're doing this on yourself, you're probably just going to put a cup there, leave it there, right? And then many sets come with multiple cups. So I'm going to grab another one that's maybe about the same size or a little bit smaller. First one was maybe about the size of a 50-cent piece. This one is going to be more around the size of like between a nickel and a quarter. And then I'm going to come further down, more towards like the lower edge or just off of the muscle belly along that inside aspect of the forearm. So if Allie here just did this to herself and she had her set of cups, she would put one on each end. And even this one is starting to lose a little bit of suction. So you may have to come back and there we go, that's a little better stick there. And while she has these cups on, she's going to start off just with some active motion of her wrist. So she's going to extend her wrist and come back to neutral. Extend, come back to neutral. Just very light, extend, come back to neutral. So this is an easy way that you can very lightly move that muscle through its full range of motion. If she wants to add tension, she would do this with a straight elbow. But even in a flex position, it's going to be a nice way for her to just gently promote some blood flow while this cup is lightly pulling up on the skin. It may also be something that's worthwhile just to decrease pain and sensitivity. So sometimes just having these cups here make an area that's painful and sensitive less sensitive. So just that tactile pressure of the cup will make you able to do this with a little less pain very often, right? And I would do that anywhere, leave these cups initially like 1 to 2 minutes. Make sure that you don't bruise very easily as you come back to do it. You can do it for longer periods, 3 to 5 minutes, 5 to 8 minutes. You may get a little bit of tingling into the hand, which is okay, as long as when you take the cups away, it goes away. But that would be one of the first initial ways that I would have someone maybe treat themselves with these cups. Now if I take these off, these are vacuum, so I just pull up this little pin and it comes off. Same thing with this one. Now if I was treating her and I'm able to manipulate the cups, I would create a little bit of suction like I did with this vacuum. And then here, if I don't put too much in there, I'll be able to slide the cup. Now there, I'm already hitting a little bit of friction where that cup doesn't want to move. So that means there's a little bit too much air taken out. So I'll come back and I'll try a little less. And then I'll press a little bit into the skin as I slide this along the length of her forearm. Very slow and controlled, and I'll try and switch my hands so you can see. I'm just slowly sliding this along the muscle belly and back up. I'll start off parallel with the tissue, and then I'll start doing a little bit of cross friction. And if I hit a spot that she feels like is tender, If it can handle it, I'll leave the cup there, and then I may leave that one there and have her go through that same active motion. I may have her working on progressively doing this in more of an elbow extended position. And then I may leave that cup there and come back and do another one. Same thing, moving the cup for anywhere between like 1 to 2 to 3 to 4 minutes. If I find a spot that's sensitive, I'll leave that one there, come back, get another cup, and then I'll work around that. If I find another point, I'll leave that there, right? Forearm is not a big area, so the maximum I'm going to put on anybody is typically going to be 2. Something that's a little bigger, like the lower back, things like that, you may use more.